Hi everybody, Dr. Bryton here for 2-Tip Tuesday. Today I want to talk about an abscess. You've probably heard of people having a tooth abscess, and more than likely you probably heard about how much pain they were in with the tooth abscess. And so I just want to talk about those things. And what I want to address first and foremost is that abscess aren't always painful, and that is one of my biggest concerns. So I'm going to grab my friend Alan here, and I want you to envision something for me. He's got an abscess, maybe on a back molar, top or bottom. But what I want you to grasp here is, how far is that from the center of his brain? It's anywhere from 3.5 to 4 centimeters. That's a big deal. Let that impact you for a moment. If you have an infection that you can't feel that's far from your brain, that far, that can be dangerous. That can be very dangerous. In fact, people have died of that thing, that very thing. And so what I want to address with you is where we can gain some value from having some of our 3D images that we've had done. And then from there, how you as the patient can take care of it. And so I've got some examples back here. These are images of a typical two-dimensional image that we take once a year to check for cavities between the teeth, check the edges of your fillings or your crowns. And I want you to see something here. This first example here, I want you to see this tooth here. It's had a root canal done in it. The crown looks ideal, literally. Everything looks perfect. Doesn't look like there's a problem at all. We took a 3D image on this person just so that we could evaluate kind of what's going on beyond just for the cavities. And look what we found. Chronic abscess right there. No pain whatsoever. That's their sinus right there, which I'll touch on here in a moment. But I want you to see that. Next patient. We had something similar. Again, margins look just amazing on this crown. Nothing looks bad at all. Had a root canal done on it. Not feeling it whatsoever. Abscess. Again, right near the sinus there. The last one, and this for me was actually the case that kind of put me over the edge of why I got a three-dimensional cone beam image so I could see things. This here was one of our staff members. And what I want you to see here, again, nothing looks bad here. Everything looks fine. For 3 years, she'd been having issues with sinus infection. She'd been having an antibiotic almost every 6 months. And she was having pain, but she thought it was a sinus issue. Did a 3D image on her, and look at that. It's almost the size of her tooth. So for 3 years, she had that 3.5 to 4 centimeters away from her brain. So a couple of things. One, we need to do our images on time and regularly. We need to. And with the technology we have now, we can see things that are invaluable. In addition to that, when we see this sort of thing and we make a recommendation that you need to see a specialist for a root canal or see the root canal specialist, in fact, this case in particular was done by a phenomenal endodontist in Caledonia, Dr. Brent Menema. He took care of this. When we see this sort of thing, we tell you should go see them. It's life-threatening. We're not joking around. It's something that is a big deal. This is a chronic infection that if you had that on your leg, you'd be freaking out. And there's good reason why. And if it's in your mouth, sometimes it's hidden. And so I like to show these, just show you the impact of this technology and just show you why it's valuable and what you can do to improve your health. So hopefully that was helpful for you, just kind of seeing what some of these 3D images can do. And I hope that it can be something you can pass on if you'd like, share it with somebody that might be helpful. But comment below if you have any questions, call us if you have any questions. Thanks so much for tuning in. Have a great week.